Hello, my name is Stephen Politano. I'm a medical student at the Ohio State University College of Medicine. I'll be presenting on continued productivity of the Otolaryngology Ultrasound Community of Practice. The Otolaryngology, or ENT, Ultrasound Community of Practice has been active at Ohio State University for 2 years now. A little bit of background, communities of practice have been at Ohio State for nearly a decade, and there are other presentations, and one that I actually did as well that I would direct you to if you wanted more information on those. But essentially, a COP is something that is a group that tries to facilitate communication between students to residents, fellows, and faculty while harnessing and kind of understanding ultrasound a little bit better within a specific field. And here we're trying to learn more ultrasound, practice ultrasound, provide research in ultrasound and otolaryngology. Historically, the ENT ultrasound COP kind of focused on just creating a foundation and working on how can we get this group to be sustained annually. Since its conception and development over the past 2 years, we've had various journal clubs, scanning sessions. We have produced some research, mainly abstracts, and provided mentorships for students interested in ENT like myself. Essentially, our ultimate goal was to increase our milestone score, which is also in previous community practice work outlined elsewhere by the university ultrasound student-led ultrasound interest group, or USIG. So we want to increase our milestone not only to achieve this objective success, but also just so we can get a better understanding of the utility of ENT ultrasound. So our goals: establish this group, conduct at least one journal club this past year, develop new ideas within research, organize research within our COP. A long-term goal will be establish a resident curriculum, as well as a plan for after this year for how we're going to continue this and succeed. These are milestone measurements that the ultrasound community of practice, ultrasound student interest group uses already. And so far, when taking a look at each of them for administrative goals, we established a COP. We started Google Drive that we collected a lot of research within ENT ultrasound, as well as ultrasound in general, just to see the utility. We did host a journal club, which had 8 students. During this, we focused on the novel scanning method for evaluating vocal fold mobility, which is interesting now because previously during the journal club it was mostly for non-head and neck providers or non-ENT providers, but now with the COVID-19 pandemic, it's rather interesting that we learn about this technique because it is a non-aerosolizing procedure compared to an office laryngoscopy. Back to our journal club, at the end, we had each student practice scanning this method of indirect arytenoid cartilage imaging with the ultrasound versus direct, which was kind of a midline. We gained a lot of positive feedback, which is encouraging moving forward. This is just the example from the paper where you can do, as you see at the top, the direct viewing of the vocal folds, and then you have an indirect, which is the arytenoid cartilage view. This past year, we also created kind of this novel parotid phantom scan. We have a lot of students interested in just trying out things and seeing if it works, and seeing if it's even has any utility. And so, as you can see up here on the top right, we have what looks to be a very small parotid gland made out of a nitrile glove using some ultrasound gel. Try to create an angled mandible, and then the right's actually what it looks like. So it's a little anechoic, the glandular structure, and within we tried to create a little adenoma with the spackle, but nonetheless we did get people excited about this, and we wrote an IRB to get this done because we had a total of 25 students attend. We created 5 models with differing amounts of pathologic material. Then we introduced these M1s, or first-year medical students, to the idea of scanning and ultrasound, as well as measuring and learning more in general about the parotid gland. We had pre and post tests, which was exciting, and you can check out my colleague Kevin Calamari's presentation for further details on that. In the past, we actually created a thyroid model, which now is a publication that if you have any time to read, I would recommend. It's rather interesting. So essentially, we used this chicken breast and created this thyroid model, and then put blackberries in it, and we were able to use ultrasound to aspirate, similar to possibly like a large thyroid cyst or other pathologies. Looking at our milestones, we grade ourselves with all four as a total of 10.5 for clinical patient care. We haven't had a time to formalize protocols, but we did write a scope of practice. In our education, we did develop some educational materials with simulations, so in addition to the level 1 and level 2. And for research, we're working towards receiving a grant for potential more phantom models to then challenge our cheaper models. And administratively, we do have quarterly meetings, and we have defined leadership, so 10.5 out of 20, which is pretty good. So far, kind of just thinking about our otolaryngologic community practice in general. Given these strict objective criteria, we're encouraged by our group's advancement. Even though this group was created 2 years ago, we did have 2 years of sustained effort, so we demonstrated kind of annual sustainability so far, and we're working towards getting more getting younger medical students interested, which we have identified a few moving forward. And then we have a goal, with our previous year's goal of journal clubs, these models, scanning sessions. We thought overall it was very productive and educational to all the members. So we'll plan on, hopefully doing similar things in the future. And specifically, our further work will include formalizing scanning procedures, identifying more faculty leaders, as well as long-term goals of establishing a resident curriculum in order to provide more opportunities to all. Any questions, I'm happy to answer them. Thank you very much.